We are streaming on YouTube. We will be live exactly by 9 a.m.
Okay, sir. Just 2 minutes. Meanwhile, slide is saving. After that, we can start, sir.
Is it visible?
No. Hello. Yes, sir. Slide is not.
Wait.
So 1 minute, sir.
Yeah, yeah, sure.
It's visible?
Yes, yes.
Can
No,
Sir.
no. Don't click on that, sir. Just open the PPT. Yeah. Now rotate the phone. I'll guide you. Don't click anywhere.
Okay.
Can you see the black box which is there? It is written. Yeah. Just move it out of the windows. Push it out of the window, sir. Push it out of the screen. Hello. The
Yes.
black box which is there, just push it out of the screen, sir.
Okay.
Sir, you don't need to click on that, sir. Yeah, just
Don't click on black box.
swipe
You
it,
just
swipe
put
it out
out
of
of
the
the
window,
window.
sir. Swipe it, swipe it. Sir, swipe outside the window. Yeah, perfect, perfect. We can start, sir.
So I will, sir. Dr. Harsha, sir. Are you ready, sir?
Yes, yes.
Sir, I will just give
So,
a small intro. After that, you can start, sir. So first of
uh,
all, I would like to say good morning to our audience and our esteemed speaker, Dr. Harsha. On behalf of Glenmark Health and team, I take this privilege to invite Dr. Harsha, who has an experience in treating Indian diabetic patients. Dr. Harsha has a rich scientific background. With his experience today, Doctor shall be discussing about remogliflozin, the most treated Indian SGLT2I and its robust data. So requesting you, Dr. Harsha, kindly take over the dice for talk.
yeah, thank you, Abhishek. I would like to thank Glenmark giving this opportunity. So now we will start, and here we will study about the how the carbohydrate effect on glucose variability and its cause and treatment. So now we will start. Okay, next slide. Yeah, so in type 2 diabetes mellitus patient, now it's global if you are looking epidemic, and where the India is a large contributor, around 100 million plus India now diabetic, up to 44% in 4 years. That is why Indian CMR study showing. So this is the data how the diabetes is growing in India, and you are the largest contributor to the type 2 diabetes mellitus. Okay, next slide. Yeah. So here it's how the carbohydrate cause of the rapid rise in diabetes in India. So doctor wants a high carbohydrate traditional Indian diet with white rice and all those things. So here the study like millets instead of white rice. Why this switch won't work if you cut the carbohydrate and add the protein. Reduce carbohydrate, increase protein to cut diabetic risks. Study it is. So here it's like change in dietary habit. When you are getting instead of white rice, millet or something, along with that, you have to do the change in your diet habit over the decade. So increase consumption of processed food and enhance by between energy intake and expenditure day by day. So Indian diets drive more than 62.3% of total energy from carbohydrate. As you know that our Indian diet contains more carbohydrate, whatever you take, rice, wheat. Mhm. So predominantly for the reflect cereal and high carbohydrate intake was associated with 40% higher risk of type 2 diabetes and 50% higher risk of pre-diabetes. So refined carbohydrate and added sugar showed the stronger association with adverse glycemic and replacing carbohydrate with protein, plant or dairy or egg fish. So this is the interventional evidence supporting carbohydrate restriction. So supporting evidence from the Indian prospective study demonstrated that low carbohydrate diet in adult type 2 diabetes mellitus was associated with favorable glycemic and metabolic improvement. And also, this finding complement national observational data by suggesting that reducing carbohydrate intake may have therapeutic value in type 2 diabetes mellitus management. Together, this study enhanced that both carbohydrate quality and quality are important determinant of the glycemic health. Next slide. Yeah, this is the journal. Yeah, wait. Effect of like BD dose over OD dose in glucose variability control. So here the study design was given like randomized with a two arm and parallel group and sample size was 75 control final analysis of 65%. And primary what of the study outcomes objective like to evaluate effect of remogliflozin on 24 hours glucose profile assured by the parameters driven by continuous glucose monitoring in Indian patient of type 2 diabetes mellitus. And secondary objective was so this study flow it's going for the 1 gram and to this flow chart. So you can hear mean of change in continuous glycemic profile across 24 hours from baseline to phase second. This showing the data representation where the glycemic profile. Next slide. So this remit glucose variability study conclusion. What of the study is given like result like significant improvement in TIR. So time in range and HbA1c level within both the groups, but no difference between the groups and significant improvement in postprandial glycemic parameter that is MPPS and postprandial 1 hour and PP 2 hours with the remogliflozin and also significant improvement in postprandial glycemic control. So these are the results from the glucose variability study with the taken remo. And next slide. So uses of SGL2 inhibitor with combination of DPP4 inhibitor for the glycemic variability control. Next, so this is a forever. Like yesterday, it's like efficacy and safety of combination of remogliflozin and with vildagliptin and fixed dose in patient with type 2 diabetes randomized this is trial and double blind study called forever study. So result is significant change from baseline in HbA1c level in both group. Next, so this is the another trial like a study tried remogliflozin MB. So in a phase 4 and it's showing the study like adult in age 18 type 2 diabetes mellitus and over 65 on overgo the glycemic control. So when in combination with SGL2 with DPP4 inhibitor. Next, on already. Next, 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 next. Wait. So this is a remogliflozin patient with type 2 diabetes hospitalized for acute decompensated heart failure. So here also it's shown that remo safe in acute heart failure. So that safety assessment monitoring and recording of adverse event, serious adverse event and adverse event needing drug discontinuation. So effect of is assessment of rate of worsening heart failure, rehospitalization for heart failure or death at 90 days, and reduction in anti-pro discharge and the 90 days, and also change in dyspnea associated NYHBLs and worsening in renal function. So these are the benefit like in the patient who are in acute heart failure or hospitalized after heart failure. This is the same thing that the data represent the safety. So summary of 2D and eco parameter showing conventional therapy and remogliflozin with the conventional therapy. And conclusion means what this remogliflozin on the glycemic variability control initiation of remogliflozin in acute heart failure patient. Again, it's changed. Conclusion, yeah, stop that. Ah. So, acute patient did not increase the incident of acute kidney injury and hypotension and hypoglycemia. And in patient with acute demonstrate failure and reduced ejection fraction, remogliflozin was well tolerated without any significant adverse effect. And its level improved significantly in both groups, but the percentage decline observed with remogliflozin was greater than the conventional therapy group at the discharge at just 12 weeks. So this is novel evidence on remogliflozin in chronic kidney disease patient. Type prospective randomized this study types and duration it was conducted for 6 months and participate 150 patient with EGFR who patient have less than 25 ml per minute and group allocation remogliflozin group patient and dapagliflozin. So this remo CKD result study just yeah. This is shown like compare baseline from the 12 weeks and 12 weeks like control the HbA1c and fast plasma glucose. That is also benefit to the remogliflozin. Yeah, next. Remo and CKD results summary of non-infantry parameter. So what is no cause of CV or renal symptoms? Yeah, so this is like Remo, AMB, this all brands like Forever study, all these studies support that remogliflozin is DPP4 inhibitor. It's safe in a CKD patient or wherever the Indian patient having the glucose variability that is a rise. So there it has benefit. Yeah, next. So these are all from my hand. Thank you.
Okay. Thank you very much, Dr. Hassa, sir. So it was really a wonderful presentation of yours, sir. And I would like to say that our audience would also entertain with this most informative session of our remogliflozin, the most suited SGLT2I for Indian T2DM patients. So I can see, doctor, there is no any like questions in Q&A. So there is no any questions I can see, so we can end up this session, Doctor. I'll just give
Yeah, yeah,
a
sure.
closing remarks, sir. Before that, sir, there is anything from your side, sir, you want to say?
No, no, it was nice. If people continue with this platform, whatever the patient education or for the doctor, everything, it's nice.
It's nice, na, sir. Okay, sir.
Yeah, yeah.
So, so, doctor, on behalf of entire Glenmark Healthian team, I express my heartfelt gratitude to you for taking out time for your busy schedule and enlightening our audience with your presentation. And it was really an experience sharing session. So we look forward to connect with you soon on such scientific forum, sir. Would you like to, sir, rejoin again, sir, in such kind of
Yeah,
scientific
yeah.
forum
Yeah, yeah.
if
If
it
time
comes in
permit,
future?
just allow me. Yeah,
Okay, sir.
I'll let
Sir,
you know.
okay, sir. So we'll our team will come and connect with you soon, sir, and we
Yeah,
will be
sure.
available, sir. Okay, sir.
Yeah, yeah.
Thank you, sir.
Thank you, Abhishek.
Yeah, with your permission, can I
Technical
conclude?
team.
Yeah, with your permission, can I conclude?
Yes, sir. We can wind up